one and all to please put your warm welcome to our first क्षेत्र में मानसिक
the light of latest advancements in the field of yogic practices and look at the of amalgamation of traditional values and science, psychotherapy and yogic mind-body
एकीकरण के अवसर and on the panel we have Miss Prathiba Subramaniam and Miss Saraswathi Menon to receive the certificate of appreciation Assistant Director of Research and Development Philosophical Literary Research Department present Dr. Tolbaños in Spain, where she organizes She's one of those few clinical psychologists from University of psychobiology and methodology. We welcome you.
has completed a professional degree in Ayurveda from Rajiv and a PhD from S. His area of expertise is integrated cardiovascular medicine, mental health, and endocrine system. Dr. Kashinath is an active researcher academic also. He has more than 50 research publications in international peer-reviewed journals and teaches yoga, therapy, PhD students, inspiring them with his vast knowledge and expertise. We welcome
Next on the panel we have Ms. Praseeda is a trained clinical family psychotherapist and yoga therapist for complex mental health conditions. She runs a website, Australasia, which is an online consulting service, formal qualifications include a master's in clinical family therapy, didactic psychotherapy, and postgraduate diploma in counseling and of pranayam from Kevalam. Our fourth panelist, Ms. Saraswathi practice and teaching experience in this tradition, having studied University of Madras and a postgraduate diploma in 2010, she co-founded Yoga specialized with the aim of making the transformation panel discussion will be moderated by Dr. Praseeda Vasudevan. Dr. Praseeda brings more than 8 years of work experience as a research officer in psychotherapy, collaborative scientific research on the efficacy of yoga and holistic health and assistant professor at the Gordon Das She is also a recognized about unearthing the scientific treasure in Indian traditional knowledge systems. Thank you, Dr. Praseeda, for taking up this responsibility for moderating this session. I request
I would just like to give a very brief background of why we have chosen this topic for the panel discussion. Means that you are trying to treatment, and this involves a therapist and a patient. And when you talk about yoga, what is it? It is a spiritual discipline. It is a discipline which has practices which are oriented towards focus and concentration. Yogic mind body therapy. So, what
Namaste. Sorry, but here anything, and I think my colleague cannot. Yes. But I think right. Laura, okay, we can start. Yeah, before test. Okay, thank you. And It's I would also as our guide. Regarding, I think Western to study mind, to rebuild and strengthen these links in order to improve emotional regulation and achieve a healthy and happy mind. How? Mainly through the promotion of healthy physical, mental, and cognitive habits. And here is where yoga can play an essential role. Through the yoga practice, the patient not only can promote healthy habits, they can still their minds, and they can train the ability of being aware of themselves and the world around. Integrating yoga and psychotherapy, we can help the patient become aware of personal beliefs, thoughts, and emotions that maybe are not appropriate or even painful. And usually they had been hidden on in a no conscious level, and we therapists can help the patient to bring all this stuff to the conscious level, integrating, accepting, and eventually transforming in a healthy manner. What I want to say is that mind is not something fixed, but it's a dynamic process. And we, the therapists, can help our patients in the process of recovering and building a healthy and happy mind. Thank you.
Now I would like to come to give your
yoga. So is there a need? Definitely, yes. Now, today the healthcare system is moving towards the holistic health. We are talking about the holistic health, where it is not the therapy which is the important, it is the patient, it is the stakeholder who is very important. And we have to give the best what each system can offer to him or her. So with that respect, it is very important to combine not only yoga and so particularly in this context it is particularly important to combine the concept, the practices, the tools of the modern psychotherapy along with the techniques of ancient wisdom, ancient Indian wisdom such as yoga. Now, both systems have their own strengths, like the modern psychotherapy, their strength is the tools, the diagnosis, and also acute remedies. The strength of the wisdom, strength of the ancient wisdom is the techniques. Now, in the conventional psychotherapy, we use the person's intelligence to interpret and modify his thoughts and behavior and help him to achieve the optimal mental health and lead a healthy life. But the conventional medicine also knows that the feelings, the thoughts, the behavior have biological aspects also. So a lot of hormones, a lot of our the systems like breathing, the digestion also govern our feelings, also govern our thought process. So unfortunately, the psychotherapy works only at the feelings and the thought process, and it involves or it uses a lot of intelligence, where the Indian, whereas the yoga, it helps us to correct the imbalances at physical level also. It corrects at the digestive system level, it balances the autonomic nervous system, which also involved in the behavior. And also, in fact, there are a lot of research studies which now establish that there is a neurobiological basis for many disorders. Okay, so hence it is very important to combine the psychotherapies along with the ancient yoga therapy to have the maximum benefits in a shorter duration with augmented results. Okay, so I think it is very important, and so for the betterment or benefit of the stakeholders, we need to combine the psychotherapy with the yoga. Thank you for inviting me personally to Dr. Praseeda. Thank you.
She practices.
Namaste. Good evening, everybody, from here in Melbourne, Australia. Well, what do I say? In this COVID climate, to be sitting here and joining in a conference such as this, situated in India, leading this topic of discussion around integration of traditional science with modern medicine, which is mental health, by a traditional yoga institute such as Kaivalya Dhamma is important and necessary at this time in our lives. So thank you, Praseeda, for inviting me today to share a very tiny aspect of my work with children around mental health, and joining in the panel and learning from my fellow presenters about their approaches towards this integration. So just to, so people can locate where my professional biases and identity lies, it is strongly embedded in mainstream psychotherapy. I'm a trained psychotherapist. I don't have a formal training in psychology, but I have training in child and family psychotherapy. And been working in the last 17 years as a clinical family therapist. And here in Australia, I do provide assessment and treatment in complex PTSD for children and young people, which they call here as developmental PTSD. So the topic of integration, I feel, between the two fields, psychology and yoga, and I can purely come from a psychotherapist point of view. I feel it has to be a dialogue, and because fundamentally the two fields come from origins are very different. And so in order to have an integration, we have to acknowledge the sources are different. And what I mean by that, I have found and experienced fundamentally psychology had started from the field of medicine and psychiatry. So the idea to find relief to pain and suffering has been driven by a medical kind of history from pediatricians, from GPs, and the field of psychology has evolved by looking at the combination of talk therapy alongside medicine to help find relief. And it's often led to immediate comfort to people. And over the time and experiences, we started to believe in something beyond words. And it's particularly the work with children who don't use words, who use different ways of expressing. It really opens up the doors for professionals to understand how can these children have their own belief system, their own emotional states, and how can we go and reach out to their emotional disturbances, not from a cognitive lens, but an experiential lens. That's how in psychotherapy has been an approach in child and family therapy to understand the beliefs that are shaping in the child's ability to articulate their own internal world and for them to be understood by the external world around them. So I think where I'm in Australia, there is a growing multicultural population, and there's an awareness that's building in the mental health sector here that acknowledging that our diagnostic tools perhaps don't have the strength to include the diverse cultural expressions and embodied ways of understanding emotions, because it has been founded from Western standards of certain normal functioning within a middle class industrialized way of European settlers. So there is a growing awareness within the mental health sector that's building when there's cultural diversity, that these diagnoses we need to treat them with lightness, not with concrete truth. And in that space is where I feel a lot of the build is, the search is happening from psychology to other areas to understand the meaning making of experiences. That's how I see it in psychotherapy for children and families. And where I see the bridge coming in to build a dialogue in the last couple of decades, I've found it has been the neuroscience theories, because they have opened up the doors to link the neurobiology. There's something deeper that's happening in our nervous system. And once that is opened up, there's been a plethora of body-based psychotherapies that is evolved, which really looks at the sensory awareness, sensory consciousness. And this is where, for me, yoga has also taken up that momentum. And also so I think the bridge, I feel, to have the dialogue between the field of psychology and yoga is neuroscience. But I think for I still am open to what integration looks like, because I still see that they have two different dialogues. But there is a capacity, I guess, to have an openness, curiosity to understand how can I take in child development, particularly work with children. And this is something in yoga, is like, how does yoga look at a maturing nerve? Like usually that I'm still curious to understand, how does yoga look at a child's developing nervous system, a child's developing personality, and how that shapes, because imbalance and stability. And this is where I am drawn to neurobiology and neuroscience definition of emotions, not the psychology, where it honors there is something inherent that within our nervous system, that emotions are embedded and serves a biological purpose. And particularly with children, if we can have that orientation towards facilitating an internal experience of relaxation and relief, not from a cognitive lens, I'm finding that there are, especially for those who have very complex conditions, we can help them feel internally an authentic space of feeling restful, rather than be driven by like a feeling state or a cognitive state. So my interest continues to research and look at in the practice of yoga for children who have got complex special needs, how that strengths from both neuroscience as well as developmental science into a conscious kind of awareness for a child, as it's interacting with the world, it's making sense of its internal world in its external interactions. So I feel that there is room to understand a little bit more for child mental health, with the open dialogue between the East and the West around that. But I also think we are far away from integration, but I'm hopeful for a dialogue.
Thank you very much. Western culture and telling us even in a culture which is Western. Now, I would like to invite Ms. Saraswathi Vasudevan to offer her opening remarks on why she thinks we need an integration between psychotherapy and yogic therapy.
Thank you, Prathiba. Thank you, Dr. Kashinath, Laura. Thank you, the organizers of the conference, for inviting me. Thank you, Praseeda. So I'm going to deviate slightly from what you all have been sharing. Before I get into the topic of integration, I want to say that yoga has much to offer in the field of mental health, because we should not forget that the earliest text on human psychology was the Yoga Sutra that was compiled over 2000 years ago. So everything that we need to know about the mind, the faculties, the functions, the propensities, the challenges, the capabilities, all these are presented in the Yoga Sutra, very much in detail. So when I'm looking at the application of yoga for mental health or any form of illness, because we have to really work with the mind. Mind is the main tool in yoga. We really have to go back to the texts such as Yoga Sutra and Sankhya cosmology, on which yoga is based. And then what does Sankhya and yoga look at the whole scheme of the psyche and the soma? These are not separate. You cannot separate the mind and the body. It is one continuum, right? On one end of the continuum is the gross body. At the other end is the most subtle aspect of the mind that we call the buddhi, the undifferentiated awareness. So when we are looking at any experience or any manifestation of illness, it can happen any point in this continuum. So healing has to be seen as a holistic process. Now, when someone comes with a health problem, particularly to do with the mind, when the mind is not directly ready to take on a practice, the mind is in a state, what we call a kshipta chitta, it's fragmented, it's like a monkey, completely dispersed. It is not ready. And if the mind is in the mudha state, we're completely dull and in great inertia, again, the mind is not ready. So only when the mind moves into the vikshipta state, where there is a certain amount of clarity and capacity for the individual to take charge, can we even start some yoga practice. So what we do is we prepare the mind by using the body and the breath. So using asana with breathing, we can really bring the rajas down, the active energy, and through pranayama bring the tamas down. So the mind is ready to take charge. So we can access the mind indirectly through the body and the breath. That's what I'm coming to say. And I feel before we are talking about integration of yoga with Western psychotherapy, I think we need to talk about integration within the field of yoga. It seems also quite fragmented that we are looking at yoga as asana, as pranayama, some meditation, some study of philosophy, where we are not bridging together the philosophy with practice. Because unless we bring Yoga Sutra into our life as a practice and take every concept and bring it into our life as a practice, I don't think we will be able to effectively address this issue of working with the mind, right, in mental illness or any form of illness for that matter. Then the question of integration with Western psychotherapy, like what Prathiba was sharing, I think we need to begin with a dialogue. It needs to be something that we are not doing at a very superficial level, like I take some tools and techniques from this, some framework from that and put it together. It doesn't work, right? Yoga has to be understood in its own framework, in its own philosophical roots. And years of study of the sutras and many of the related texts is required for us to get into the mind. It's like an ocean to understand that. And then how do we use the tools of yoga to apply this knowledge in therapy? And then how do we really see how we can complement these systems together? That is what I think would be more interesting than to quickly get into this idea of integrating, because any kind of superficial level of integration is going to minimize or even dilute some of this knowledge that exists in both the systems. So that's what I would like to start with. Thank you.
For offering. Now, what I would like starting with Dr. Laura again, to share integrate psychotherapy, psychology, same field, but everybody has kindly share her experiences of working in a mental health Dr. Laura.
Thank you. Regarding my work on mental health, I work on two different approaches. One is my individual clinical practice, where I'm focused on an integration of yoga and psychology. Most of the patients I treat in my clinical practice suffer from neurotic disorder, such as anxiety and obsessive compulsive disorder, and mood disorder such as depression and bipolar disorder. My therapy is based on yoga body practice such as asanas, kriyas, giving a special emphasis to the awareness of the body sensation, relaxation, the sensation of tension, interoceptive awareness. And in this way, we can work in what we say in psychology in a bottom-up direction. We work on the physical level to act on the emotional and cognitive level. We also practice pranayama to still the mind and increase the awareness of the inner energy. And we practice with the patient relaxation and meditation, as well as psychological counseling. The psychological counseling is based on the integration of all the levels of the patient experience: physical, emotional, cognitive, social, and spiritual. And through the promotion or through the enhancement of a mindful ability, attitude on their own feelings, emotions, and thoughts, and with the relation with the world around. One of the most important tools we have as a psychotherapist is the empathy towards the patient and a non-judgment attitude, which can create a warm and safe atmosphere where the patient can feel at ease. I think this is one of the more important things in the healing process. So on one hand, with the yoga practice, we have a set of techniques for coping with stress, reducing psychophysiological activity, still the mind. And on the other hand, we enhance, or we help to the patient to enhance the awareness of themselves and their own thoughts, emotions, and feelings. In a way, they can develop a more objective vision of themselves and understand themselves better. Through the awareness, through this attitude, this awareness attitude, we can develop what we call a decentering ability. The decentering ability is an attitude which create a space between the situation or the stimuli and the response, giving the freedom to choose a conscious and voluntary response instead of an automatic reaction. This makes the patient increase the acceptance and reduce the reactivity. And in other words, the person can feel that they can take control of their own acts and on their own life. My other area of work is my work in a mental health hospital, where I work with patients diagnosed with psychotic disorder, such as schizophrenia and intellectual disability. We work in an integrative program where we apply yoga therapy as a complementary therapy together with psychiatric attention, health education, occupational therapy, physical exercise as well. And recently, we have assessed a group of these patients in quality of life. What happened is this kind of patient with a chronic disorder, long-term disorder, we cannot expect total healing, but we can work on improving the quality of life and the autonomy of the patient. So we have assessed a group of patients which follow a yoga program after a period of 5 months. We designed a yoga program, a yoga intervention, based on the Gitananda Rishikultura Ashtanga yoga tradition, and we adapt the practice to the special needs and condition of these patients. I will show you if I can share a couple of slides with you to show the assessment we did with this patient. Wait a minute. Yeah, yes. As I said before, the patient follow yoga program during 5 months, and we measure quality of life in this patient. For the assessment of quality of life, we use an instrument called REQOL20. This is a questionnaire, consists in 20 questions related to quality of life and 1 question related to mental health. We measure pre and poster measurement before and after the yoga intervention. And as you see here, the green bar is the pre-test measurement and the orange bar is the post-test measurement. All the patients is a small group of patients, 9 patients. All the patients show a significant all the patients show a improvement in quality of life. But according to the author of the questionnaire, we can consider significant clinical improvement when the difference between the pre and post-test measurement is 10 or more points, right? So from the total of 9 participants or patients, 6 of them achieve this significant clinical improvement. Here you can see all the areas which cover the questionnaire: activity, hope, belonging and relationship, self-perception, well-being, choice, control and autonomy, and physical health. The questionnaire has a single question for physical health. In the tail, you can see we have 2 groups. One group corresponds to the patients diagnosed with schizophrenia, and the other group are the patient diagnosed with intellectual disability. And in the first group, all of the participants report an improvement in quality of life, and 3 of them, from the total of 5, show a clinical significant improvement in quality of life, and in the intellectual disability, 3 from the total of 4 show a clinical significant improvement. Related to the physical health, 8 of the total from the total of 9 of the patient report improvement in his or her physical level, health level, and 1 of them report the same level of physical health. So, yeah, thank you. So just to finish this part of my presentation, just I would like to say that all the patients which follow this intervention, this yoga program, are very, very motivated to attend the yoga session, and very motivated to learn yoga practice with the warm up, because the program, I would like to talk a little bit about the program. The program consists in warm up exercise, tension releasing exercise, then practice of asanas, kriyas, pranayama as well, and finally relaxation and even meditation, simple meditation practice such as breathing awareness. And the patient show very high motivation to attend the session through the tension releasing practice. They can release the tension, the emotional and physical tension, and they can be more in contact with the physical sensation, and they can enjoy the asanas in stillness. Then they are ready to practice pranayama, which sustaining attention is needed. And finally, with the relaxation practice, the patient can elicit the relaxation response, and they can integrate this response as a part of their body wisdom. Thank you very much.
Thank you so much, Dr. Laura. I would like to invite Dr. Metri. But integrating psychology, psychotherapy, as well as Ayurvedic therapy, and the philosophy behind all these therapies. If Dr. Metri could share his work with us. Dr. Metri?
Endocrine disorders among women, the cardiovascular disease, and also musculoskeletal problems. We have done quite a few studies assessing the mental health measures among the population with lifestyle related disorders. We also worked among the workplace stress, among the people with the workplace stress, using yoga at workplace, and we found the encouraging results in terms of reduction in the stress, in terms of reduction in the risk of musculoskeletal problems. And I would like to share a few slides with you all. So that So today we have this panel discussion on integrating mainstream psychotherapy with the yoga. So if you compare in the last 50 years, there is enormous growth in the community about the mental health. In fact, we celebrate Mental Health Day nowadays, isn't it? We also know that how this mental health actually influences our physical health, our well-being and quality of life. At the same time, thanks to modern medicine, that we have a lot of diagnostic tools in the modern science. In fact, we have understood the organic causes. There are studies which demonstrate the identified the risk factors of the mental health disorders. We know psychosocial factor, we know the family factor, and we also have understood the neurobiological basis of the mental health disorders. And all this has helped us to reduce the mental health morbidities and make one to feel, experience, and live a healthy life. At the same time, we also have effective solutions for mental health problems. There are medications, there are a lot of tranquilizers, there are a variety of antidepressant medications, there are antipsychotic medications, and we also have psychotherapies. We have cognitive behavioral therapy, we have EMDR, we have behavioral activation therapy, we have compassion focused therapy, and so on. There are many. Now, what all these psychotherapies focus is what actually we want to establish, or what actually we want to bring the changes in the person is to improve his awareness. Because psychotherapy, it utilizes the intelligence to make the person or the patient to be aware of his thoughts, his feelings, and his behavior, and to modify the same. And in the psychotherapy, we also focus on making the person relax, to improve the relaxation levels, emotional ventilation, reduce the symptoms of anxiety, depression, stress, and also empower the patients with the positive feelings, thoughts, and behavior. So for this, we use most of the time we use the cognitive facet of the person. So we need their attention. The patient has to be very much attentive on his behavior. He has to be aware of his feelings, his thoughts. At the same time, he has to interpret, he has to change his interpretation pattern. So in the disease, patient often interpret his circumstances in a negative way, and we have to bring that positive interpretation aspect in him. That is exactly the objectives of the modern psychotherapy. When we look at the yoga, so the very definition of the yoga is, according to one of the sage is Yoga Vashishta, is Mana Prashamanopayo Yoga. Yoga is a method to relax the mind. Patanjali Yoga Sutra says Yoga Chitta Vritti Nirodha. It's nothing but to gain the mastery over the mind, or the feelings, or the thoughts, or the emotions. That is how we bring the mastery over our behavior. And Bhagavad Gita says it is the inner ability of the individual to maintain the equilibrium at all situations of the life, whether it is the up or whether it is a down state. Okay. So it is to empower the person to have a healthy mind where everything is in his control. Okay. Now, yoga has, when we say yoga, it has several components. It is not only the physical practices like asana, or it is just not just the breathing practices. It is not just even the mental practices like dharana, dhyana, and all that. But actually, in combination to all these, there are several other aspects like yamas, niyamas. It is a lifestyle. So there is the lifestyle. There is very famous quotation from the Bhagavad Gita is Yuktahara viharasya yukta chestasya karmasu yukta swapnavabodhasya yogo bhavati dukkha. That means it is the moderation, it is the appropriateness in the ahara, vihara, our food, our behavior, our sleeping pattern, our habits. So all that is together. So yoga is a lifestyle. Now, so these all are the scientific studies I am just telling you. So in fact, in our personal studies also, we have observed all these things, that yoga helps to relax the body, relax the mind. Okay. So there are the techniques. So we oftenly use this. There's something called deep relaxation technique. there is something called quick relaxation techniques. At university setup, there are a lot of students come here. There are university staffs. There are some patients who approach here, and we found a very enormous change. In fact, I would like to share a simple one example. There is a staff here uh, who had the diabetes, and so his diabetes was not under control. And the reason for that, he is very impatient person. He is very uh, 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 so, so 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 there is some personality problem. So he is unable to see what he does and how his emotions are governing. So we taught him just quick relaxation technique, and we asked him to practice at least 3 times in a day. So he practiced quick relaxation techniques. So after maybe 20 days, he came back and said, now my blood glucose levels are under control. Now I am able to see what I am doing. Now I am able to see where is my mistake. Now I am working, but working with relaxation. So such a simple techniques that makes the person to feel relaxed and have the insight on what he is doing and his behavior. Similarly, we have Yoga Nidra. We have mindfulness breathing. We have Nadanusandana, where we have to just take a deep breath, and when we exhale, we chant Om, like that. So there are various advanced technique like mind sound resonance technique. There is pranayama. So pranayama also helps us to relax the mind. Okay. Now, there are a lot of studies which have demonstrated that yoga improves the awareness. The pranayama improves the awareness. So there is uninostril breathing. There is Chandra Nuloma. There is Surya Nuloma Viloma. There is alternate nostril breathing, Nadi Shodhana Pranayama. There is dynamic yogic breathing, Kapalabhati, Bhastrika. There is meditation, Dharana, Dhyana, home meditation, mindfulness meditation. All these techniques increase the level of awareness. It makes the person to be aware of his feelings. That is what is one of the objectives of the modern psychotherapy also. Trataka, it improves the cognitive functions, attention, awareness. And there are a lot of balancing asanas. In fact, many patients, so after practicing asanas, so they are more focused on the asana. So they are unable to do pranayama because they feel restless. Some patient in the beginning. So when they do these balancing postures, they come back and say that nowadays I'm very much aware about what I'm doing, how I am doing. Earlier, I used to commit a lot of mistakes in my work. Now, the number of mistakes are significantly reduced. So these balancing asanas makes us to focus on the physical body, the postures, the way we stand. So that actually improves the attention, concentration. That helps us to overcome these mental problems. And yoga improves cognition. There are a lot of research studies. There are many systematic reviews, meta-analysis articles, which have clearly stated that yoga improves cognitive abilities. I feel that yoga and psychotherapy together will definitely have a synergetic effects, and they complement each other, and also they augment the results. Okay, so if you can combine the psychotherapy with yoga, definitely the results will be augmented. So we can achieve these results even in a short time of duration. And of course, as I said in the beginning, that the psychotherapy is more focused on the mental aspect, where the yoga focuses on both mental and physical aspects. That is how it combining both, we not only have the changes in the mind, feeling, thoughts, and behavior, we can also have a changes on the body organs and systems, which may help them to overcome the problems, overcome the physical problems, overcome the, or they may help them to prevent the various physical disorders. These are few studies which are published. I would like to share. So this is not our study, but I would like to share that in this study they have combined the cognitive behavioral therapy with yoga and found very encouraging results. Okay, so we are talking about the integration of psychotherapy and yoga. In fact, there are already studies, and these studies have shown a very positive results. And looking at all these studies, we can definitely say that the combination of psychotherapy and yoga will definitely help to have a better results in a shorter duration. So there are many more. I just, due to lack of time, I have shared only few. These are few our studies. So this is one study we did it in HIV positive patients, where we had two groups. One group received only antiretroviral therapy, and the other group received antiretroviral therapy plus yoga. And there are a lot of positive there are a lot of positive changes in the mental health parameters. Particularly, there is a decreased anxiety, there is a decreased depression scores after the yoga intervention. Similarly, we had a study in orphanage children. So orphanage children are more vulnerable for mental health issues such as depression, low self-esteem, and all that. What we found is just 2 weeks of yoga intervention helped them to have a better self-esteem, and the depression level, the anxiety level got significantly reduced. Similarly, we did some work in the job related stress or job stress. So we did it in a employees of diamond cutting industry. So after 3 months of yoga intervention, we found significant improvement in their pain, in their quality of life, and also the fatigue, the stress levels, all that significantly got reduced. Similarly, we did a study on female teachers, particularly. So in the female teachers, the cognitive functions got enhanced, and the anxiety, depression, the stress level got significantly reduced after 1 month of yoga therapy. Similarly, there is a technique called mind sound resonance technique. So we did particularly 3 studies to assess the immediate effect of mind sound resonance technique. So we gave half an hour of mind sound resonance technique, and we measured the anxiety before and after. In patients with anxiety disorder, we also measured it in patients with diabetes and in patients with hypertension. What we found is very encouraging. So even in a short duration of 30 minutes, half an hour, there was significant reduction in the anxiety after these simple tests. So yoga has got a very simple techniques, very easy to do practice, and it definitely have a lot of things to do. And when it is combined with the yoga therapy, with the psychotherapy, I'm sure that the results will be wonderful. Thank you.
Now I would like to experiences. She works as a family therapist. She works with children and adolescents. She has been using yoga therapy along with her training of psychotherapy. So we would like to hear from Pratibha ji as to what the challenges have been when she has used yoga therapy in a Western culture, how open people are, how she has been able to do it, and also some best practices. Pratibha ji, could you please share your experiences? Thank you.
Thank you, Praseeda. I can't hide my emotions, so I'm an open book for people. If you're seeing me grin all the time like a little kid, is because there's echoes at this side, so it's quite funky. I didn't quite hear entirely what Praseeda you introduced, so I could just hear snippets. So wow, already I'm hearing the very interesting perspectives from Laura and Dr. Metri. So what I thought I will share to the audiences and to the panel, because it's more personal, I'm here having a dialogue here. I thought I will ask people to see the details of my work, of framework and results in the conference seminar article that I had sent out. But I will spend some time to just share from a perspective of being a psychotherapist here in Australia and working within the mental health system here for children, what has made me, how have I been drawn to yoga therapy and exploring that pathway. Children get presented in my work has there's deep emotional pain and distress is the source of the problems underlying their behaviors. And it's not uncommon, but I would be seeing children with referred by psychiatrists or school psychologists who have with more than one diagnosed conditions like mood disorders, developmental delay or personality disorders. And also parents or carers have gone through the system of working really hard for a long time finding a solution, but feeling quite disheartened that there is no recovery. And these children often also will come with quite a very strong descriptive lens from the adults around them, saying that they are quite unapproachable or quite challenging and risk-taking behaviors, catching the attention of the justice system over here. And when you meet these children and families, you often discover that there is often a condition of intergenerational mental health sitting, like mom or dad is suffering from mental health and extended families raising the child like grandparents or uncles and aunties. So what I will give you an insight, I'll share just how Australian system works with psychotherapy for a child. And when I say a child, it's aged from 6 to 24. Usually there is it's recognized there are, for recovery, especially around child behaviors that have quite deep emotional pain, you start with the physiology and then move towards relational safety. And in Australia, generally, when kids who have complex conditions, they come, the phase one work usually is dealt by occupational therapists or someone who help with emotional regulation to teach about feelings. And then the complementary work of working with the child and the parents and the family is where I step in to complement alongside with the occupational therapists and other self-regulatory specialists. So and during that period of work of psychotherapy, I was running trainings and workshops to school teachers, educators, and occupational therapists, because what I was discovering and what they were requiring was how to translate these development theories or trauma theories into for children into education system for the child to focus or regulation. So I used to run workshops to help teachers to tailor an individual plan of a lesson plan that would understand where the child's capacity is to focus and hold attention, and then slowly build the capacity to perform at their level. And I would do the same workshops for regulation OTs to help understand where is this child disconnected in their body, and what would be the starting point to build that regulation so they can start to build that pathway of recovery. And during these times of these workshops, there are often themes that will be raised around self-regulation challenges for these children. Either they would say the child knows how to do these calming strategies, but they don't want to apply, or they're very poor in their motivation, or the teachers will say, well, for a very short period, but it doesn't last. So, and I was discovering in the family and child therapy work that these strategies that they were learning, there's something missing out in also their ability to reflect and adapt and apply. So let me give you, I thought I'll quickly share with you a sample family that I might be typically seeing. So a psychiatrist might refer to me, a single mother in her early 20s with 2 primary school girls. And mom would be diagnosed with clinical depression and anxiety, and she might also suffer from sleep. And the oldest child could be drawing the attention of the school, where teachers are worried she's getting extremely quiet and withdrawn. And the youngest child could be seen as a problem child who's always getting into trouble. Typically, a family like this, their native tongue may not be English, so and it's often maybe mom or dad. The mom might not be also quite literate. She would not have been encouraged to read or write or go to school as a young girl. So by the time such families come and see me, they would often mom would have gone to attend classes to learn about anger and strategies to calm. And the same for the 2 children. They would be sent to OTs and taught how to be okay with feelings and ways to manage them. Despite all this learning, it would be normal again for them to come into sessions with me and share the struggle of how difficult it is to apply it when they are in each other's spaces. So, and the work I do often is always as a unit. So I might work with the siblings as sisters, or I might work with as a family, mom and daughter. I tend to not to see the child alone, because often the child comes with a very low self-esteem that something is wrong. I'm a problem for everybody. So I tend to not make that stigma by seeing the child alone. And so in a scenario like this family, as you unravel the work of these challenges, the emotional pain that they're suffering, it's not uncommon. So for example, the mom would say, the minute I see this child do something, I feel this burning sensation in my chest. And it's always there, it never goes away, but it increases and it frightens me. And I'm frightened something bad might happen. And so she feels like a failure. No matter how much I try these strategies, something is wrong with me. So I'm a bad mother or a bad person because I can't seem to do this. And it might be a similar experience to the child. Say the oldest child might gravitate towards looking after the younger sister in a way to attempt calmness in the house, but in its avoidance, it's trapping in its body an internal fear state, an anxious regulatory sensation. And she tends to carry this belief that be wary of speaking or be careful. So often it manifests in like public anxiety, social anxiety, because whatever she learns, like you can talk about feelings, it's okay to express yourself. Her context in the world that she's connecting, it's not congruent. So how to apply? So often it's the belief systems and the ego. Again, children's ego is formed by how the loved ones see them. So I think these unconscious beliefs we're often getting trapped in this translation between learning something and moving into the application. And for me, that was what I was really interested in, is what is it about? I was really wanting to learn about what is it about these emotions. If it's so simple that can be taught, like emotions and feelings are so easy, why these people with special needs are finding it hard to apply it, and what can we do differently to understand emotional regulation or these states, internal states that they seem to struggle and they relate to being as distressing or painful as in finding relief. So it is a curiosity, I guess, for me to understand emotions and regulations that made me want to, first of all, redefine what are emotions actually, and can we look at beyond thoughts and feelings and cognition and behavior? Is it something deeper? And for me, this is where I really, the intersectionality for me between traditional science of yoga and neurobiology, like affective neuroscience, really brought me closer to coming close to actually capturing the experience that these children that I was working with were finding. So one of the main, I think I find in affective neuroscience, which is a branch of, it's more a biological, in the field of biology, not in psychology, they really look at, and they have discovered, it's a very recent just discovery, and who knows what else they'll find, but at this time they have discovered that fundamentally, biologically, every species has like 7 neural circuits of emotional neural circuits. And there's a purpose, the biological purpose to seek, to care, to protect, to avoid, and explore. So in this approach of affective neuroscience, emotion is described as a subjective experience. And any situation has the potential to arouse an emotional experience. So what it describes is a situation can has the potential for the body to arouse the nervous system, and the body responds to this arousal, which we see as reaction. And we experience this change in our body at that time. And this is the difference. This is where it slightly moves away from psychology, where it is a felt sense. It is an experience that cannot be described in words. It is a physiology. It's something that comes, that flows. And I think in Hindi, we have the word called bhavana or ehsas. And I think that captures what it means in the neuroscience about this experience that one has internally in response to a situation. And often, the labeling of the response, often, especially for children, is labeled by somebody witnessing that reaction and saying, oh, you must be angry. But it may or may not match to the internal state. And that is the difference between affect and the children that I work with, and particularly who have very complex conditions, they often will say, I don't feel calm, that though I say it is calm, but that feeling of calm doesn't resonate in their being. And so there is often a disconnect they feel between doing something that people say should be calming to actually feeling calm when they're doing it. So to me, that disconnect I felt, and within that I was very intrigued about using the traditional principles of yoga, where you have to, it is a very intersubjective experience when you're doing any prana or asana or anything. It is always an interaction between the breath, body, and I say consciousness. I think it is something I think it's beyond thoughts. It is about a belief system that comes and it awakens. And to me, that emotional belief that I need to feel calm, because, and sometimes you'll see kids when they breathe, they do it with such, it looks like as if they are being forcing themselves, but they're actually working hard because the ego is telling, I need to breathe to feel calm. So it's often that kind of interplay that happens with consciousness that I was really intrigued, and I was wanting to find a way to use the integration of that consciousness, the sensory, whatever that comes internally, how they're tuning in, and the ego that's associated with that sensation. Is it treated as a welcoming experience or rejecting as, this is too much, I'm overwhelmed, I don't want to feel this. So often that is so I was really interested in that, because the children or the families that I've seen, they often get very rigid, and their patterns is very short, sharp, and they cannot stay in a moment for long periods. So it was important for me to create, so I wanted to explore, and this was purely because in the Western world, the use of yoga as a psychotherapy, as a valid treatment is still, again, from a systemic point of view, is challenging, and it's and for real reasons. There still needs to be more evidence comes from India or authentic traditional institutes around using yoga as a legitimate pathway of recovery. So I deliberately wanted to explore without feeling the pressure of any time or commitment to understand the use of yoga for some of these children or emotional conditions, if we can facilitate a framework that would apply this, discover the unique pattern, how do they move from place of relaxation to distress, what is the transition, and how does the body sensations and the beliefs play out within the conditions that they were having. And that could be anger or panic attacks or a deep sense of depression or loneliness. And it was really important for me to also understand the strength of that ego consciousness, what I say, that would be very natural for the children to carry. That's the developmental need, because the ego is shaped by the experiences. How is that is also attached with the nervous system when they are feeling distressed, and when they move from a distress to relax? Do they believe? Can they stay there? Or do they immediately panic and then push that away because they feel quite frightened or not knowing how to control? So I was wanting, and this framework, I guess I wanted to apply it. And I tried it in different kind of scenarios. I worked with a certain, again, a select group with talking with schools and principals with special needs to do a very handful amount of group work. But I would do a tailored plan, meeting the child one-to-one, understand, read their physiology, their basic capacity, their threshold of regulation. What is the threshold to be relaxed? And then what moves to the place of distress quickly? And then either through a small group work with the kids together or one-to-one around, I would do school term-based treatments around emotional regulation. And it was for a period of 1 year, and it was interesting to see the one of the other important piece of this, I would say, that is very critical, important, is the role of the therapist. It's how do I approach in facilitating an embodied experience of relaxation, because this often is the challenging bit. And for me, this was a challenging bit in the session to facilitate. And often I would use videos of the sessions and review it and view it and tweak the plans and communication. How is my language inviting? So it's a facilitation, especially for a child to enter its inner world, who's already feeling quite shameful or judged, to make them enter the world with curiosity and not be frightened with whatever that comes through that experience. It is an important and integral part of the facilitation. And this sounds simple, but it's very challenging for complex conditions. And usually it's in that facilitation, the responsibility as a therapist is to know my own biases, my own kind of beliefs and attitudes and rigidity that's coming. I need to trust the process and not be driven by the outcome. I need to have the solution that this child should be relaxed. I should trust the process of allowing the child to feel and experience that something new, unfamiliar, with my support, and to be able to join in and to move to a different place. And so that is a very critical piece in this work. And I would say, so far I'm using this framework, and it's the active engagement of the child that comes that makes the transformation happen, because you're not feeding the child about how to feel. You're allowing the child to enter by itself and discover something. And often the discovery, we wouldn't know where it would be. So for example, I was having one girl who really felt when she was doing Bhastrika, it actually was calming for her. And whereas another girl who was having the same kind of issues of anxiety and panic attack, she would find Sheetali quite cool and calming and really made her feel in control. So I think it really, again, it is very important as me as a therapist to be open to what comes up in that connection with the child's experience within, again, their life story, within the experience of the context of their world. And the other really important part of this work that I do is always, in every session, always invite the child to have an intention. Intention is important because that becomes like sankalpa. You got to have an intention, a motivation, because that is where the desire is. The desire, even if it is something imaginative, I don't care, because it invites me into the world in a way that I can join in. And that joining in is the starting point of our work together in how that intention, that sankalpa, is inviting the ability, other thought processes, other patterns into the mind body, into the breath and movement and interaction. So I feel this is a self-funded pet project of mine that I am joyfully enjoying the process, because I feel the change is happening that's not short-term, but a bit long-term. And I would say it takes at least minimum of 6 months of work, or maximum 1 year, if you do it weekly with the support. And I see actually a long-term work happening where the child is able to apply this internal awareness into the real world without any, coaching or anything. It's their curiosity or the awareness that comes as a byproduct that they start to discover, I can try this in this place. And so to me, that says there's something here that I would like to continue researching and exploring. So I'll end at this point, and I feel I've talked a lot. Sorry, I didn't see the message of conclusion.
What is the role of mind in health and healing? Over to you, Saraswati ji.
Thank you, Praseeda. I would just like to take a minute for all of us to settle down. Since we're going to be talking about the mind and the application of the mind in healing, it won't harm to just take a minute to breathe and let the mind rest in the breath. So as you inhale, become aware of what is there in the mind. And as you exhale, let go of whatever you may be holding on to with the mind and your senses. You can do this with your eyes closed. Just inhale freely and exhale deeply and completely. So that you can fully and completely come into yourself, into your body, be with your breath. And the mind is settling down. You have to bear with me for a few more minutes before you can go for a break. So just continue to breathe as you listen to me, and I'm trying to see if I can be as brief as possible. The first thing I want to share is that I am a yoga teacher and a yoga therapist from a very traditional school, trained in the Krishnamacharya tradition of yoga, studied with Sri T.K. Videskachar, where personalized yoga therapy is practiced. So all that I have taught and practiced over the last 3 decades, close to 3 decades, is working with people one-on-one. And there is a very constant, active effort to go back to the roots of yoga, to the philosophy, the understanding of Yoga Sutra, the Sankhya cosmology, Ayurveda, etc., to really understand the mind, the workings of the mind, and how can we use the mind as an effective tool for healing. So we keep coming back to this again and again and again. And the intervention itself is individual centric. So we are not so much looking at the condition, but the individual. So we keep the individual as a center of our focus. Sometimes the labels are useful to understand the condition, but very often the labels become an obstacle for the individual to really take charge of themselves. So we work with the individual. And the other very important thing is we are not just looking at, okay, what asana to teach or what pranayama to give. We're not so much focusing on the tools and the techniques that we want to offer, but really based on the understanding of the individual in their own context, what is the best thing that we can do to help them. So it's a very holistic approach. Through observation, through listening, we try and understand the individual in all dimensions, and all of you have spoken about it. So this is something that we do continuously over a long period of time as we work with the individual. So a very integral part of that is the therapist or the teacher. My own mind. How do I train my own mind to be able to meet each individual where they are afresh every time they came back to me? So how do I clean my mind? How do I hold my mind in a way that I can hold a space that is non-judgmental? Right? Yoga Sutra talks about Vitaraga Vishayam Vachittam. So the aspiration of a yoga teacher or therapist is to be that Vitaraga Vishayam, which is a mind that is free from attachment, that cannot cause any kind of fear or pain to another individual. So to be that clear mirror, and it's an aspiration. I agree that it's not very easy to be that. So our own practice becomes very important. And that's why I said the study of the texts like Yoga Sutra is a lifelong process for us. Every week, many of us spend at least 8 to 10 hours studying the text, reflecting on it, practicing it, coming back and discussing about it, because that is the way that we anchor to the roots of yoga and look at everything, look at the person, look at their problem, look at their context from that perspective and see what is that yoga can offer. Coming to the therapeutic framework, we draw from the Yoga Sutra. So we try and understand the problem and the ramifications of the problem, how much it is impacting the individual, and most important is the individual ready to see, acknowledge, and take charge of their life and say, now I'm ready to work with it. That is the hayam, first step. Then we go into the causes. Then we set up goals which are both short-term and long-term. Then we come to the application of the tools. So of course, when somebody comes with problems with the mind, we can't directly work with the mind because it's already distracted, fragmented, dull, right? You can talk a lot, but maybe nothing would enter the mind. So we work with the body, we work with asana, we work with pranayama, and in a very active way. You know, if you ask a person to close their eyes and meditate or do some breathing, we don't know where the mind is going. So we really have to see how to engage the individual and keep them in this moment, keep them in the moment, present moment experience of the reality. So the body, the breath, the senses are always in this moment. They're never in the past or the future. The only culprit is the mind, which can run into the past or move into the future. So how do we anchor the mind with the body through the breath? And how do we use the senses to direct the mind so that it can hold its attention for a short while? And then slowly, little by little, cumulatively, we help the mind to develop a new samskara, a new conditioning. So you recondition the body, you recondition the breath, through which you recondition the mind and the senses. And this is a practice that takes a long period of time because the teacher has to work with that individual. It's not just the changes that happen. You know, they do practice for a few days, they feel great about it. Then what happens? People often let go of the practice because they feel that they are healed. They go back to the problem. So how do you sustain the changes and how do you help the person to completely change and transform themselves, change their food habits, change their lifestyle, change those factors that are actively contributing to the problem? So for all this to happen, the teacher has to work with the student on a one-on-one basis continuously. And what we have found is the role of the community is extremely important. And I can only talk about the community of practitioners, many of us who have been studying and practicing for a long time, and how we are able to deal with the problems of our own mind by actively engaging with the community. I can speak very less about people who come for therapy because many of them don't stay for very long. And I'm still taking baby steps towards yoga research in that area. But we can definitely say that with the help of a teacher, who is working on oneself and really staying with the path of study and self-inquiry, and working with variety of tools which are not fixed, which are not standardized, and an evolving practice over a period of time, there can be definite changes in the state of mind, in the way one would engage with their life and the choices one makes. And slowly the person becomes, we call the person a student, the person becomes more and more empowered to take care of oneself. So Krishnamacharya defined yoga as swatantra, one who has one's own tools to take care of oneself. And only when the student becomes independent of the teacher, that they know what to do, they know what practices to choose and how to take care of themselves. Occasionally they may come for help to us. Then we know that yoga is working and yoga is happening for that individual. So until then, this hand-holding and gentle nudging and support is what the teacher offers. So we're really hoping that we can do more work in the area of Antaranga Yoga Sadhana, which is really working with the deeper aspects of the mind, using the dharana practices, for which the mind has to be really prepared to be able to stay with a certain inquiry and look at oneself and work with oneself at a very deep level. And all the Bahiranga Sadhana is to support and sustain this whole process, teacher being a very integral part of the process. So I would stop here. Thank you for the opportunity.
Thank you so much, Saraswati ji, for giving us such a deep and how yoga comes into therapy. I would like you to take this question, Saraswati ji. So the question is, yoga approach, sense of I and me is ignorance. However, in psychology, I is at the center. It is my feeling, my living, my thoughts. So how do we really integrate this kind of paradox that we have in both these disciplines? I request Saraswati ji to take this question.
So we call this asmita, right? And this whole idea of the self. And very often our understanding of the self or the idea of the self is fragmented. For example, if I am very much connected to or identifying with who I am as a person, say I'm a very kind person, for example. Suppose I identify with this idea of I'm a kind person. Of course, I practice yoga, I have to be kind, right? You agree, right? Now, I can also be unkind. But I'm not willing to look at that part of me. So that becomes my shadow, right? Now, what yoga helps me to do is it helps me to look at that part of me which is unkind. In my thought, in my behavior, in my action, in my responses to other people. So when I'm seeing that ability that I have, which is the opposite of that kindness, and if I'm able to really hold that polarity and embrace it and understand that I'm more than this. I can be kind, I can be unkind, I can be much more than it. I can be, anything, right? So that helps me to hold this idea of the self, this definition of the self more lightly. And that is a starting point for any deeper inquiry. Otherwise, I would always be shielding. I would always be walking around with the sword and armor, right? The whole idea is to really allow the self to dissolve, but that has to happen. It can only happen through inquiry, through really looking at myself at a very deep level, very, very honestly and with ruthless compassion, of course.
Thank you. A few more questions, but we have already, we are hard pressed for time. Let us admit that, because we have the workshop scheduled for 5:15. We have to make the arrangements in the hall for Professor Bhogal's workshop. So I regret not taking any more questions from the lovely audience that we have here. I will just conclude by saying that in this panel discussion, we have learned that health, be it physical or mental, it is very important that the mind is ready for any therapy to happen, be it psychotherapy or any form of therapy. So I feel yoga comes in this in a major way in treatment, in psychotherapy. It just makes the patient, his or her mind, more open, more receptive, more accepting, more aware, and also helps the patient to have more self-discipline so that treatment can actually lead to better mental health. And the patient can abide by the treatment. So yoga is all about self-regulation. And in psychology, we are also trying to enable self-regulation. And with that, I would like to conclude this panel discussion. I thank all the panelists for their wonderful wisdom, their time, and all the knowledge and information they have shared with all of us. And we do hope to meet once again in Kevaledham with all the panelists. They couldn't come here. I'm sure most of them, even people like Dr. Laura who live in Canary Islands, Spain, they would have loved to come to Kevaledham as she does once a year. And even Prathiba ji and definitely Dr. Kashinath Metri and Saraswathi ji were planning to come, but the pandemic has its limitations. So let us just conclude this panel discussion and have many more panel discussions, at least 2 for sure, in this conference. Thank you so much.